So if you feel like it's tough to find a great healthcare provider in the Valley, you're not alone. A recent survey showed that 40% of Americans aren't confident about the quality of local doctors. Well, Healthcare Partners Nevada, they're seeking to change that with high-quality care and an unmatched total care model. Here to tell us how they're serving Southern Nevadans better is Dr. Marija Krstic. Also with us, two of Dr. Kristic's patients, Derek and Margaret Buckle. Welcome to all three of you. How are you?
Thank you.
Thank you.
Very good. Thank you for having us.
Let's talk about the survey that I mentioned at the top there. It also showed that half Americans believe that higher quality care means by default it's more expensive, and that's not necessarily the case, is it?
No, not with our total care model. We've developed this, we refer to total care model over time that provides very comprehensive patient-focused care that is basically of no cost to the patient. So they get the highest quality of care without having to pay for it. And it doesn't just involve us as physicians, providers, primary care physicians. It's a whole team working together trying to provide the highest quality of care. So the moment the patient enters our office, they're greeted by our office staff, and there's valuable information gathered by our office staff from the moment they come in. And then further on, when I see the patient, we go over their concerns, we go over everything that they may need in a long run. And those are simple things of daily living, transportation, assistance with medications. And lots of times I need help, a lot actually. And that's where our nurses, care coordinators, and our social workers do an amazing job just trying to coordinate our patients' care and just to basically fulfill all their needs.
Well,
and
of course. Yeah.
cut the cost.
What Healthcare Partners does, if I may, I mean, knowing this isn't a requirement in America to have digital health records, but you have that. I think we've all been to the situation. We go to one doctor, we have to fill out all this paperwork. We go to the next doctor, we have to fill out all the same paperwork again. And it's not so because you keep the same information from place to place.
Correct. And we do communicate so well with our specialists and our inpatient team. It's teamwork again, working all together for the best of our patients, making sure they're healthy and happy all together.
Absolutely. Well, we have two of your patients right here. Derek, let's talk to you. You're a patient of Dr. Kristic's. Let's talk about your experience with the total care model and how she's made an impact on your health.
Oh, well, we're both in our 80s now, so we've had lots of experience with many doctors, and Dr. Krstic is right up the top of our list. I mean, we feel very comfortable going to see her. I've been a diabetic, an insulin-dependent diabetic now for 25 years, and in the past I've had to go to a specialist to keep control of my blood sugar. But with Dr. Krstic, she has encouraged me to be more aggressive and disciplined and take care of my own blood sugar. I take a check at least 4 times a day and take the required amount of insulin. And because of that, when I have my quarterly check to see what my average is, it's equivalent to that of a normal person without diabetes. So
the fact that you're on top of it, she won't yell at you.
No, that's right, that's right. Yes, and it's as I say, in the past I've had to go to a specialist for that. I find this to be very gratifying, and that's my most significant thing I think that I can thank her for.
No question.
Yeah.
Well, I know you brought a briefcase, a little case that we can take a look at. Doctor, let's talk about what you did to help him with his weight loss and his diabetes as well.
Well, I've been very fortunate all these years to have patients like Derek and Margaret, and they're so motivated and so eager to learn and so knowledgeable about their health. So we've over time established a good plan of diabetic diet, but when I say diabetic diet, there's no particular diabetic diet.
Yeah.
Healthy diet
is healthy diet.
Right.
Yeah, of course.
So people with and without diabetes could sit at the same table and eat an excellent healthy diet.
Yes.
It's just a bit different with diabetes in regards to counting the carbs, especially with insulin requirements and dosing the insulin based on the grams of carbs.
We have about 40 seconds left. Margaret,
Right.
I want to get your experience with healthcare partners. I mean, how happy have you been with your care?
I've been very happy with the, everybody's been very good to us. When we go into the office, they all say hi to us, and and then when we see Dr. Krstic, she's very good to us, and she does everything and tells us what to do, and we make sure we do what she tells us.
It's amazing. If you actually do what the doctor says, it's incredible what might happen.
Oh yes, we do that.
Well, it's a total pleasure, and you're doing a great job, and you've been doing great work. Congratulations on your health improving. And what's in the case, by the way?
Well, this is something that they gave all of the patients, and it's a wonderful thing. It has 12 partitions covering all kinds of aspects of our health.
Oh, so whenever you get a printout,
yes,
you can put it in there.
And it covers test results and referrals, immunization.
No more questions.
And importantly, planning for the next appointment, which is very helpful.
That's very, very helpful, and it's great work.
Yeah.
Thank you so much. It's great having you. Thank you so much. Again, Healthcare Partners Nevada, their total care model. It helps provide superior care and services. To learn more about Healthcare Partners Nevada, you could just visit the website on your screen. They're also on Facebook and Twitter. All right, still